I studied finance and marketing at UWA, and I went on to do the graduate program at WA Health as a graduate finance and business analyst. So far I've done 2 placements, and my first one was at Fiona Stanley Hospital in the finance team, and my second one that I'm currently in is in the financial policy team at Department of Health. I really wanted to improve my finance and business analyst skills after graduating, and I knew that being at WA Health would be a really great opportunity to learn everything hands-on and face-to-face and collaborate so much easier with everyone because everyone is in WA. So that really interested me. My first placement at Fiona Stanley Hospital was super interesting because I got to work on a project that involved both the clinical side of things and the financial side. So I was meeting a lot with the head of department for ED, emergency department, and I was also speaking to directors of finance, different finance and business analysts, and so I was combining a lot of really interesting information about healthcare and how hospitals are running and translating that into a strategic solution. The best thing about working at WA Health is the flexibility. I've found that over the last 2 placements, I've learned so much and they've been so different to each other. Working at a hospital versus working at the Department of Health, you pick up so many different skills, you get this high level, really overarching, interesting context to your work, and I've found, particularly working at the hospital, it's been so rewarding and so motivating because without having a clinical background, I'm impacting people in the hospital, and I find that is so awesome. When else would I ever be able to do something like that? Something that's really surprised me about Department of Health is the amount of systems that they have to learn. So I thought, I knew Excel, but it goes way beyond that. So that is really cool. There's so much to learn. And on top of that, there is so much data available for anyone interested in big data and drawing that down to get a high level strategic response to what's happening. It's so interesting, and you think you've seen big data, but you haven't seen big data until you do this. Some of the people I worked with at Fiona Stanley were so experienced in the health department. They both were previously grads, and so they continued on and they've been around. They know so much about the health system, and any questions I had, they could give me really in-depth answers, and that really helped my learning. On top of that, the business manager for my team pushed me to go for things that I didn't have the confidence to apply for, and I really appreciated that. A highlight for me during my time at WA Health was going to the Australasian College of Health Service Management conference. It was so awesome because we heard all from these different leaders, not only in healthcare, but also in other fields. So Mark McGowan was there, which is awesome. And so was Rick Arden from Channel 7, so I'm sure everyone knows him. And it was just so cool, hearing from these different healthcare CEOs. The Ramsay Healthcare CEO was there as well, and she was so inspiring. And it just made me think, I want to be like these people. My advice to future graduates is to make sure any gaps in your knowledge, you should be seeking them out. And this program is a really great opportunity to seek them out because there is an expert in WA Health on everything. So know what you want to learn and always be hungry for more information. I found that's been really useful for me. And on top of that, it's also good to do your research. In preparing for this role and doing my application, I actually stumbled across the Graduate Focus magazine of the previous year, and you can read all about what the experiences of all the previous grads have been. And that gave me a really good idea of what kind of work I'd be expecting to do, and it helped me shape my career development, so that was great. If you're thinking about applying for this program at WA Health, I would strongly recommend it because not only do you learn so many different skills and you meet so many different people, but you also make really great friends with the other graduates on the program and you spend a lot of time with them. So that's a win-win for me. Where do I see myself within the next 2 to 5 years? Well, I think there's so much to explore in WA Health. So I'm excited because everything I've done has been so different and I've loved it. So I'm going to keep exploring, and I know that my true north is doing something creative and also collaborating with teams And on top of that, I love public speaking and presenting information to people. So that's where I see myself being. Something that I'm aiming to achieve in my career is balancing my love for number crunching and problem solving with my creative side. And I look to take these technical problems and display it in a really interesting and creative way. And if I can achieve that, then I'll be really happy.